welcome back. It is 12:16. We're a little late in hooking up with Elenia Kolokotronis. My humble apologies for just can you hear me? Welcome to the program. Okay. um, all I can say is please be patient. We're sorting out our technical hitches and we will bring Elenia to you in a minute or two. Thank you indeed for bearing with us. The time is 12:17. Whilst we're waiting to get hooked up with Elenia, I also want to tell you that we'll be joined in a short while by Rafik Hassan, and we're going to be talking about, obviously, the spirituality of Ramadan. And I think spirituality, when you talk about the spirit of Ramadan, everyone, and I'm going to be talking to different people throughout the month of Ramadan about the spirit of Ramadan. And that's my topic. My topic is going to be the spirit of Ramadan. And each and every guest that I'm going to have on throughout the month of Ramadan is going to bring a different aspect of Ramadan to us. And I think you and I are going to learn and grow um, by talking to all these different people. They're going to enrich our knowledge and they are going to make us truly see the beauty of the month of Ramadan. So I look forward to talking with Rafik Hassan, but I see that Milazi Boy and Nazreen, my producer, are working hard behind the controls trying to get us connected up with Elenia. So let's try one more time. Elenia, good afternoon. Are you there? Are you joining us for what is a pretty important discussion right here on Salam Media? Hello? Okay, let's do this.
Julie, can you hear me?
I can hear you now. Hello
Hello,
there.
lovely Julie. How are you?
I'm good, thank you. And you?
Good, thank you.
Okay, I'm disappointed. I thought that we're going to be doing a Facebook Live interview with you, but it looks
Yeah,
like...
no, technology decided otherwise.
Okay. Elenia, we now really... I overran with my other interviews, and my next guest is going to be standing by for 12:30. So I'm going to hand over to you to talk to us about bioethics and clinical nutrition. Now, I'm not sure if you are aware that the fasting month, the Muslim or the Islamic fasting month of Ramadan begins tomorrow. It's a Thursday. I'm wondering, how does clinical nutrition, how can we work to our best advantage and eat healthily and let it work for us optimally in the month of Ramadan, where we don't eat and drink from sunrise to sunset?
Julie, I think the important thing is that when you do have your first meal of the day, it's one that is able to sustain you throughout the entire day, because obviously, I mean, there's nothing happening. You know, you're not eating or drinking anything. So I think it's important, especially with persons practicing the sacred tradition, that they, you know, if they have medical issues, that it's okayed by their medical practitioner, that they don't feel that they're putting themselves at risk health-wise. But just generally, it's a practice that's been done for so long that, you know, everyone already knows what to do. But my suggestion is that when you do have your meal, the second meal, in the evenings, it should just be one that's nutritious. Try to stay away from foods that are highly, you know, that aren't good, full of sugar, full of bad fat, fried foods. Those tend to make you want to eat some more. I know. I know, Julie.
You're
those
almost
are foods that
stating the impossible.
I know, Julie, but just remember, these are foods that, even though it's, you know, it's what's part and parcel of the practice. It does tend to make you want to eat some more, whereas foods that are, more natural, more clean, they tend to sate the body longer. Try and be as hydrated as possible, and that's what my advice is.
All right, Elenia, let's talk about bioethics and clinical nutrition. What is this all about? Look, you and I've talked many a time on different platforms, and it's all you always bring such wisdom to the discussion.
I love you. You love me, Julie. Julie, this is something that I've been very passionate about, and I've actually been going against the grain for many years, because bioethics and the relationship of human nutrition is basically the research findings and ethics of how people with medical conditions are nourished. For example, if someone is a patient that's just had surgery and they're a diabetic patient, is the clinical nutrition prominent in the hospital kitchen? Is clinical nutrition something that medical students are taught, and they're not? I think I think that they do 1% of nutrition and what it does for the body. And my question is, if we know that food is medicine or poison for the body, why is food not the first point of call for diet-related medical conditions? Obviously, if someone's broken their arm, Julie, the doctor's not going to say, go and have some more salad and stay away from sugar and it'll heal. That's not what I'm saying. I'm fighting for the medical practitioners, for the medical aides, and for the governing bodies to understand that if it's a diet-related illness, why is the patient's nutrition not looked at first? They've thrown all these medications, glucophages, EpiPens, and all of that, and there is room for that. But my concern is, why is nutrition not part and parcel of that treatment way forward, or why isn't it, for starters, the only way forward?
Yeah, I agree with you, because whenever you visit a hospital patient, or if you yourself are in hospital, the question is never asked if you are allergic, or I think the only thing they asked you is whether you want a kosher or a halal meal. But
correct, or if you're allergic to penicillin and nothing else.
Yeah, and and then of course the standard there is they serve you without fail custard and jelly with every meal.
That's it. That's
so
it, Julie. And the thing is,
absolutely correct. So what
100%.
What sort of response are you getting to this, Elenia?
I'm not. Julie, I've been fighting with the dominating health council of South Africa for 10 years now. They constantly have an issue why they can't register a clinical nutritionist. And if they do register you, you have to do random courses about pricing and things that have absolutely nothing to do with what we're doing or what we're advocating. But South Africa is, we know, number one with child obesity in sub-Saharan Africa, and cardiovascular diseases, obesity, diabetes, prediabetes. These are all things that could have been prevented if institutions like schools, hospitals, universities, those kinds of things had a course that people could undertake, or if hospitals were more lenient. There's no nutrition protocol anywhere, Julie, nowhere.
I know that you are. I'm not sure if that has changed, but I do know the last time you and I spoke, you were working at a clinic or a hospital somewhere in Midrand.
So what I do is that, if it's a fertility patient or a patient with insulin, the doctors will refer them to me, and then I'll go and see them there, or we'll meet otherwise. But we're nowhere near where I can go and have 5 offices in 5 different hospitals or anything like that. It's very difficult for someone who's practicing food as the medicine. South Africa is nowhere near there, unfortunately. Yeah, and also, Julian, in all honesty, I'm working with. I've worked with before, but this was the one that highlighted it. I'm working with a breast cancer patient. She was diagnosed, and on the same day given an A4 piece of paper of foods that you can and can't eat, and that was it. There's no education, there's no explanation, it's just so overlooked, and we really need to start doing something, because we've got all these medications, we've got all these diets, we've got all of it, and we're just still so sick.
So what would your ideal role be in a situation like this? Let's take your cancer patient, and you were just given a slip of paper of the do's and don'ts, or what to eat and what not to eat. How do you see your role in a situation like this? Because if I would, I'm just thinking, I'm putting myself in her shoes. If I had to be given a slip of paper with what you can, what you can't eat, I don't think I'd give any I wouldn't take any notice. I think my focus would be more on my breast cancer.
Exactly that, the shock of that diagnosis.
Yes.
What do you do? How do you communicate this to your family? It's the truth. But the thing is, Julie, in South Africa, especially lacking in this, there is no funding for nutritional research. There's none of that. So my role, and it's not at all financial, Julie. I've told you this
Yes.
in a personal capacity. I'm never going to get rich by what I do, but my profession
Yes.
is my purpose and my passion too. So it's okay. But I think that, I mean, and if you look at I can't remember if it was Harvard or it was one of those Premier League universities, they released statistics that only about 18% of doctors know about food and a clinical diagnosis, which makes a dietitian or clinical nutritionist even more valuable to something like that. But for me, where I would step in, we would just completely allow her to express how she feels and then explain to her, you know, the best way moving forward nutritionally. Because obviously when you do start cancer treatment, you know, chemotherapy, all of those kinds of things, your digestive system is compromised. But, you know, they don't know this. So once it's communicated, they know what to expect, they understand what foods can and can't do for them. It kind of changes their mindset. Whereas, you know, that doesn't happen 90% of the time when someone's just been diagnosed and shown the way forward, which is very upsetting.
I should imagine, too, that if you don't understand your condition, the type of meds you're taking, it could conflict or interact with the type of food you eat. So
100%.
That is how important your role then would be in any setting, any hospital setting. What do you see? Let's assume we're in an ideal world.
Yes.
How do you want to see your role to play out in a clinic or in a hospital setting?
Julie, I want it to be as important as people view medical doctors, surgeons, pharmacists. I want it to be as important because at the end of the day, Julie, what's going to be our precaution, what's going to be our safety net is how we treated our bodies by what we eat. We're either going to poison it or we're either going to keep it going as long as possible. And people, you know, we need all forms of therapy. We know this, but Julie, food is vitally important, especially with a diet-related patient that's very ill, that's on top of all of the stressing, on top of all of that taking a lot of medication. Food is vitally important. And myself, not just myself, but so many other people that do what I do have actually seen obesity. We've seen hypertension. We've seen those things not get better, but be healed completely by just changing how they're eating, not eating less or being starved, just how they're eating. It's so important. And it also, Julie, clinical nutrition is such a multifaceted study. Why isn't it in the universities? Why isn't it in the hospitals as you walk in? Like the pharmacies in the hospital, the surgeons are in the hospital. Why isn't there a clinical nutritionist in every hospital or at every clinic or readily available that the government will, you know, send out to more rural areas? Why?
So, Elenia, who ideally, as you and I speak now, who are the people who actually are referred to you or who would interact with you? I'm getting a sense that you're not necessarily seeing the people that really, really need your help. Critically ill people that together with their medication and the right nutrition, they could be well on the road to recovery. But one part of their healing is totally absent, and that is obviously clinical nutrition.
Yeah. So the thing is, Julie, COVID made things very difficult. So there is obviously no going into wards in any way.
Sure.
But what is great is that people see results, you know, and so the word of mouth goes along. I'm now doing a lot of free work. So I go out, you know, it's not anything I discuss. I don't like to discuss that. But I mean, I do a lot of free work. I do go out and see people that need assistance. But more often than not, and it's so sad to say, it breaks my heart to say it is sometimes a bit too late.
Oh, I'm so sorry to hear that.
Yeah, it's very upsetting. But I mean, at least the ones that we can help, we do so. There are some amazing doctors that I've worked with that in conjunction with my help and theirs get the patient to optimal, you know, functioning.
Right.
They you know, things go well, everything's okay. We just need more of it, Julie. We need a lot more of it. And again, it's not anything financial. It's for the better of the patient, for the person.
I know you've got a heart of gold, Elenia. And listen, love, we need to wrap up. We will talk with you again sometime soon. How do people get in touch with you?
They can contact me on my personal number anytime, 0766325411, or they can visit my website, eleniak.com.
eleniak.com. Okay,
That's
brilliant. Nice talking to you.
Thank you for having me. Thank you.
It's a pleasure. Go
Sending
well.
love.
And
Bye-bye.
to you. Bye-bye. 12:31 exactly. Time once again to visit the markets. And when we get back, we'll be talking the spirit of Ramadan with Rafiq Hassan from IFRI.
What makes Randary Jewelers